The heavy menstrual bleeding, there are actually drugs that your doctor can give to help to reduce the heavy bleeding or to help to reduce the length of the bleeding. What's up, beautiful people? Welcome to another exciting episode of Ask Dr. 𝐭, you already know. And in today's episode, we're going to be talking about fibroids. So someone actually sent me a DM asking me that how would I know if I have fibroids? Okay, so for those of you that don't know what fibroids are, they are non-cancerous growths in the womb, okay, and they usually happen during reproductive age, and they're very common in black women. Now, most women that have fibroids don't even know they have fibroids. This is because a lot of times fibroids don't even cause any symptoms, okay. However, some women that have fibroids might experience symptoms, and some of the symptoms could be heavy menstrual bleeding. So for example, if you have really heavy periods every time consistently, where you have to use like 4 or 5 pads in a day, or if your periods are lasting longer than 1 week, right? Or if you are feeling pelvic pain or pressure, right? Or you are having constipation or difficulty emptying your bladder. These may be some signs that you may have uterine fibroids, okay? And one of the ways we can diagnose uterine fibroids is by doing a physical exam. So sometimes on examination, you can actually feel the fibroids, right? They feel very lumpy. It makes the womb feel very lumpy. Some fibroids can vary in size. They can be really tiny that are not visible to the human eye, or they can be really big, even almost as big as a baby's head, right? And another way to diagnose fibroids is by scans. A simple ultrasound scan will detect fibroids, okay? And that's one of the cheapest and easiest ways of diagnosing fibroids. So now, when we talk about treatment, okay, most times if the fibroids are not causing you any symptoms, any major symptoms or any symptoms at all, most times you don't have to treat it, right? Because fibroids can be there without causing any harm. Most women can get pregnant even with fibroids and will successfully carry the baby to full term and give birth to the baby with no issues or complications. Yes, in some women, fibroids might cause miscarriages, or fibroids could cause infertility depending on the location of the fibroids, but this is not very common. If a doctor evaluates you and determines that your fibroids need treatment, then some of the treatments are available are drugs that can shrink the size of the fibroids, or surgery to take out the fibroids. Now, bear in mind that just because that your fibroids have been taken out does not mean that they can recur. Even though you have surgery to remove fibroids, the downside is that they can always recur at any time. So that you have surgery does not mean you are done with fibroids. So these are some of the factors that you want to consider when you are going for a treatment of fibroids. Like, if the fibroids are not disturbing you, if you're not experiencing any symptoms, then it's not necessary to treat the fibroids because, like I said, they can recur. However, if you're experiencing symptoms due to fibroids, then you might want to meet your doctor to help with the treatment of some of these symptoms. Like, for example, the heavy menstrual bleeding. There are actually drugs that your doctor can give to help to reduce the heavy bleeding or to help to reduce the length of the bleeding. Then shrinking the size of the fibroids might also help to relieve some of these symptoms, because fibroids are very responsive to hormones. One of the causes of fibroids, female hormones tend to be responsible for the growth of fibroids. Another causes could be genetic. So if your mom had it, if your sister had it, first degree relatives, then chances are you yourself might have fibroids. So what you should know is fibroids are not cancerous, and rarely do they ever become cancerous. Fibroids are treatable, okay, either with medication or with surgery. And people with fibroids can successfully get pregnant and carry their babies to full term with no complications during pregnancy or childbirth. So I hope with these few points of mine, I've been able to answer all the questions that you might have about fibroids. If you enjoyed watching this video so far, don't forget to click the like button, subscribe and share with anyone you think might need to see this. Like I always say, a healthy you is a happy you. See you next week.